Let's bring in emergency physician and public health professor at George Washington University, Dr. Leana Wen. She previously served as Baltimore's health commissioner. Her recent op-ed discusses the issues pregnant women are facing during this pandemic, and she is pregnant herself, due right now, as well as the need to start planning ahead to beat the coronavirus. Also with us, Pulitzer Prize-winning author and staff writer for The New Yorker, Dr. Siddhartha Mukherjee. He is a cancer physician researcher whose new piece for The New Yorker tackles the question, how does the coronavirus behave inside a patient? Leana, I want to start with you, and actually a piece you wrote for Time about how we are sort of constantly behind the curve on this. What would it take in terms of the types of testing and other things we need out there to finally be ahead of the curve?
That's right, Mika. So far, all along, we have been reacting to what's already happened instead of anticipating for what's ahead. And the disappointing thing is that we actually know what we need. We know that we have this three-pronged strategy. One is that we have to stabilize our healthcare system. We just can't have a situation where medical workers don't have personal protective equipment, where we're running out of ventilators when we know what supplies we need. We need to ramp up production and have this wartime mobilization now. The second is we need testing, because otherwise we will always be behind. We'll always be looking at numbers that we don't even know if they're anywhere close to accurate if we're not doing surveillance testing in our communities. We can't predict where the next outbreak is. And the third is we need aggressive social distancing, because that is the one thing that each and every one of us can do. While the government is mobilizing and doing everything that the government should be doing, each individual citizen can be practicing good hand and face hygiene, and we can be doing social distancing so that we stop the transmission of COVID-19. That's simple. There's a three-pronged strategy. We should be implementing that now and pulling out all the stops, or else we're going to look back in time and think about every day that's lost because it's valuable time that's going to cost lives.
Dr. Mukherjee, you're looking at the spread of the virus, but also how it spreads within the body. It seems that there's so much mystery as to what's happening with this virus as it attacks one person versus another. They can have so many different symptoms. What are you learning?
Well, we're learning many things. The first thing is that we're learning that there are several people who have no symptoms who can be shedding the virus. And that's why it's very important for everyone, not just the sick, but everyone to practice social distancing. It may come to the fact that we probably need to be extraordinarily careful and keep the social distancing for several weeks, if not months from now. The second thing that we're learning is that the amount of virus exposure that you get, the load of virus exposure that you get for most viruses, for most respiratory viruses, is related to whether you get infected or not. So that, of course, is one reason for the logic of social distancing, but also the fact that we aren't using, even the public isn't using hand hygiene and masks appropriately enough. If we need essential workers to get back to work, we need even the simple surgical masks. We need a simple surgical mask, and we need clear instructions from the CDC about how to decontaminate these masks. In other words, if the outside of the mask gets droplets or fomites, that we need very simple instructions about how to decontaminate those masks. We need that information now so that essential workers can go back while we maintain the hospitals and as Leana said, as Dr. Wen said, ramp up production and keep our healthcare workers safe.
Dr. Leana Wen, we're seeing more cities that are looking toward becoming hotspots. Chicago, Los Angeles, New Orleans, Detroit. Probably more will percolate up on the graph of the map of the country as this virus spreads. Do you think that the president's new deadline is realistic scientifically?
Well, I'm glad that there is a new deadline, because otherwise we would have faced even more confusion. So at least we have until the end of April, as per what he said yesterday. But I am very concerned. I mean, we have New York as clearly this epicenter now of COVID-19, and other cities are not far behind. We're looking at Louisiana and Michigan and others. But the key is that we don't actually know what the next hotspots are going to be because we lack those data. We just don't know because of lack of testing about what other areas are just on the cusp and how we can bolster capacity. I mean, we as a country are prepared to tackle hotspots one at a time, but we have to remember that this is not a hurricane. This is not a one-time situation. We have to mobilize for the long run, and governors and mayors are saying all over the country, here's what we need, not just for right now, but in 2 weeks' time, in 4 weeks' time. And we really have to listen to these local leaders, as well as the projection by public health experts about all the resources that we need for the long term. And if it's not now to pull out all the stops and get these resources, I don't know what that time is.
Yeah, Dr. Mukherjee, also, as we talk about the long run, there are obviously many models that show that this may go away in the spring and early summer, but could return in the fall. And so how do you believe that's a possibility, a good possibility? And if so, how does that instruct us to plan moving forward?
Well, I think there's a good possibility it will come back in the fall. And one of the things that we should be doing and instituting, again, agreeing with Dr. Wen, doing community-based testing. In other words, not doing testing on people who have symptoms, because that's a biased sample. If you're sick, you'll want to be tested. What you want to do is you want to be able to go and randomly test, specifically test communities up front, be on the front of the ball rather than behind the ball. And that's not been instituted yet. And we want to figure out how many people are infected in given geographical hotspots and whether they've already become immune or not. And we need to do that in a random way, not in, if you get sick, get tested. And if we can do that, what's probably going to happen, my prediction is that by the fall, we'll start seeing hotspots rise again. But in that case, we'll be up front on the ball. We'll know what to do before those hotspots really become, flaring fires as they did in New York City.
And that's obviously the scenario that we are all hoping for. Doctors Wen and Mukherjee, thank you so much. We greatly appreciate you being there and being here. And Mika, it is so important that we do. As the doctor said, we have widespread testing, even random testing. That'll help us out. And also what we talked about earlier this morning, we can get the antibody testing to see who's had the virus. If it is true that maybe 60, 70% of people get this virus and maybe asymptomatic or just have mild conditions, if they have the antibody test and they have those antibodies, then this fall, they can go back to school, they can go back into the workforce, they can be active and not worry about coming down and spreading the pandemic.
Flying blind. And Dr. Leana Wen was one of the first to say on our show, this isn't spring break, this isn't a snow day, that this physical distancing has to happen indefinitely, and it has to be taken seriously. She has a piece in the Washington Post. It's a scary time to be pregnant, but I'm grateful. She's due any day, so she's got a lot to offer in terms of insight of what life is like as not just a health care advocate, but as a soon-to-be new mother again in the age of COVID-19.
And we really appreciate her being on the show, along with all of our other guests during this difficult time.
Much more ahead. We're back in just 2 minutes.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.